Welcome to the High Vibe Moms Club, the podcast for ambitious women ready to ditch burnout, diet culture, and mom guilt so they can feel hot, healthy, and radiant from the inside out. I'm your host, Shannon Getz, and this isn't just another wellness podcast. It's a movement. If you're ready to raise your vibe, reset your health, and step into your most confident self, you're in the right place. Welcome back to another episode of High Vibe Moms Club. And today I am joined by Dr. Andrea, a licensed naturopathic medical doctor who specializes in helping women uncover the root cause behind our symptoms like fatigue, anxiety, inflammation, and, we keep hearing about hormone imbalance, even when their labs are coming back as normal. And I know many of you listening are doing everything right, but still not feeling like ourselves. So this conversation is going to be incredibly eye-opening. Dr. Andrea, I'm so excited to have you here. Welcome to the show.
Thank you. I'm excited to be here.
Yay. So I want to get started with your story. What led you into medicine, specifically focusing on root cause healing through the advanced lab testing?
So I was originally introduced to naturopathic medicine back when I lived in Connecticut. I'm from the East Coast originally,
Okay.
but when I was younger, a teenager, I had horrible cystic acne. People don't believe me now because my skin is pretty clear, thankfully, but
Beautiful.
I had pustules that hurt, my face hurts, right? And I tried so many topical things, nothing helped. And then I eventually was put on Accutane. And while I was on the medication, my acne cleared up, right? But my face was so dry, it was awful. But as soon as I got off, all of my acne came back. And I was devastated, right? Because it affects your self-esteem, especially when you're in high school. So I dealt with that until my early 20s. And one of my friends was talking about how she saw a naturopath. And I'm like, what is that? Because no one knew what that was at the time. So I was like, okay, let me just try it. I went and I saw her, and it was literally life-changing. I found out I had food sensitivities, and she tested a couple of my micronutrient levels, which were all depleted. So within a couple of months of working with her, my skin completely cleared up and has stayed pretty consistently clear, other than an occasional zit here or there. But I actually ended up shadowing her years later when I was dabbling about going to medical school, because my undergrad was communication. So I was doing something completely different. And shadowing her, I saw, wow, like people can get better a lot of the times just changing their diet and lifestyle and adding a couple supplements. So that was what really sparked my interest into going to school for naturopathic medicine.
Wow. Yeah, both of my brothers were actually on Accutane in high school as well. And I know that it affected their mood swings. So it wasn't just, yes, you had clear skin, but there's these side effects that are also associated with it, right?
Right. And for women, you have to do pregnancy testing quite often because it's, if you get pregnant, it can be detrimental to the baby, and then checking liver enzymes and all these things. And I mean, my face was basically peeling off, but my skin was acne free. But then it all came back again because I wasn't addressing like the root cause of why I had it in the first place.
Yeah. Yeah. And so I think a lot of women are told that to just trust conventional medicine because they might not know anything different. I know that's like with my family, with myself. I have a history of gastrointestinal issues, and they're like, here, just take this medicine. You'll be fine. Versus really diving deeper to figure out what that root cause is. And that's amazing that you said in college is when you found out about all this, right? Early 20s, I'm assuming.
My early 20s, yes.
Yeah, that's so amazing that you found out. I mean, it still feels late, I'm sure, but early enough to where it's not so far down the line. You're like, where has this been my whole life?
I know. And it was, dealing with chronic fatigue as a young person, and then realizing, oh, it was something I was eating was making me inflamed and tired and my face breaking out.
Yes, yes. So for those women who are listening and they go to their regular doctor and they find out, like, hey, I'm exhausted. I'm breaking out. Something's not quite right, but my labs are normal. So, I mean, what else? What else do I have to do? And you specialize in this advanced blood work. So, what are some of those patterns or anything that most doctors are missing?
Again, I always ask, well, what did they actually check? Because typically, when I'm getting patients, they're getting a couple labs checked if they're lucky and being
Mm-hmm.
told those are normal. So I'm like, if you're not really looking at anything, of course, everything's fine, right? But when you do a deeper dive, usually there's something that shows up, right? Because there's a reason why you're feeling that way.
Mm-hmm.
And we have to figure it out. I'm like a little health detective. So I'll take whatever labs they did, and usually my panels are a lot more comprehensive than what my
Mm-hmm.
patients get.
Mm-hmm. And what are some of the most common things as the detective? What are some of the most common things that you uncover as root cause?
A lot of people in general are vitamin D deficient. I think
Oh.
that's the most common thing I see that goes um, that gets passed through as you're in the range, but it's not okay. So the vitamin D range, for example, on most labs is 30 to 100. So you can be at 30 and be told you're normal, but that's not okay. You're going to have
Mhm.
symptoms still. For women, especially, I see like iron as a big issue. And that's a marker that doesn't typically get checked because doctors are just running a CBC, which looks at your blood cells. And if that's normal, they're told there's no iron issue, but that's not the case. You can have a normal CBC with normal red blood cells and still have low iron. I see that all the time. Those are
Mhm.
really common for women, especially. And then inflammation. A lot of people are walking around inflamed and they don't know it, again, because that's not a marker that's typically checked by conventional medicine. So those ones are big ones. And then you want to talk about all the hormonal stuff on top of
Yeah.
it. Usually there's something going on related with stress. So,
Yeah.
uh, yeah, my panels are a lot more comprehensive, I'd say, than a typical blood panel.
Yeah. No, absolutely. And I think the only time that I felt like they did extensive checks was when I was pregnant. Was the only time where they're like, oh, okay, yeah, your iron is low. And you are like borderline anemic. But outside of that, yeah, it's just the standard. So they don't really take a deep dive, which it sounds like what we all need is that deep dive to figure out what exactly is going on in our complex systems as women.
Exactly, especially to just get a baseline. If it's someone's first time, a lot of people haven't had a full panel of blood work ever, or maybe a couple of years before, if anything. And it's always good to have a baseline so that if you start to have changes, we can compare. Okay, the past 6 months or the past year, there's been a change here, and figure out why.
And you touched on stress. So, how exactly does chronic stress affect or impact the hormones and everything else, our energy, as far as what you've seen in the lab?
I honestly think stress is a bigger problem than most women are led to believe. I think, especially because, you're talking about that high achieving mom, which is your demographic. So many women feel like they have to push through. And I think they're just used to running on a high level that they don't even realize what's going on internally. I see
Mhm.
a lot of patients that they tell me they don't have any stress, right? And then I get a rundown and I'm like, how could you not? You're literally going all day working, you have a family and everything else that's going on. And then I look at their labs and I can see it showing up there. So I don't know anyone that doesn't have stress, right? And it affects the body differently versus something that's short-term stress versus what I usually see with women where it's like a chronic stress that's actually depleting hormones and the cortisol is actually too low for the time of morning that it should be. So it definitely, I can see it in the labs even if people necessarily don't feel it.
Oh, okay. Yeah,
Mhm.
because I know when we wake up, that's typically where like our cortisol increases and spikes. And you're saying that I know when I got the lab work done, it had to be fasted. And so is that kind of the same where you're noticing in the mornings, most likely they're fasting and you're like, wait. something's not quite right here.
Yes, and I'll do a blood test just to get a snapshot of in the morning, but I know all over the internet, everyone talks about you need to lower cortisol, but that's such a small percentage of people that I actually see. Most women, especially I see, especially that perimenopause, menopausal crowd, their
Mhm.
cortisol is actually like depleted. To work
Wow.
on building that up, and that's due to chronic stress. So there's different stages of adrenal
Mm.
fatigue in our field or that stress response. And when it's a constant thing, cortisol's too low, it starts to pull from all the other sex hormones. And that's actually one of the reasons women will start to go into like that early perimenopause, menopausal stage. It has to do with that stress response.
Wow. Yeah, that's amazing to know because I know all over it's like high cortisol, and then you don't really realize, okay, yeah, maybe it's a dip in it. Just like for myself, they were saying, oh, you have acid reflux because your acidity is so high, but it was the opposite. I had acid reflux because it was so low.
Exactly. It's low stomach acid. People are like, wait, what? So
Yeah. Okay.
the stomach lining. I know. It's yeah. I see. I have some women that have high cortisol, but it's not as common. I'd say most women their cortisol is depleted when I check
Yes.
it. Hmm.
And then you have experience. Obviously, you kind of touched on like supplements, and after like their next step, once they get their blood panel and you are able to read, okay, this is low or this is high. Yes, there are changes in lifestyle, but what have you seen as far as supplements that are the most beneficial at this moment?
For just women in general, or more of like that menopausal, perimenopausal crowd.
Yeah, more of that crowd because that's kind of my audience. We're either having babies or slowly transitioning out and getting to our 40s.
I know that's me right now. So I think again, like generally, that population, most people benefit from like a really good quality vitamin D. Most people I check are vitamin D deficient. When you think about like bone health and hormone health, immune support, most people are not eating enough fish. I'd say like a fish oil or fish supplement, like something for
Mhm.
omegas to help with inflammation. Those two I usually always recommend to that demographic. And I'd say like possibly B vitamins would be like the next one, but those three I would say are like usually in my supplement pack for those women.
Okay. And then there's also women who are listening and they're like, peptides. Peptides are everywhere. And NAD plus and GLP-1s. And some of them are so stuck because they've been following everything is right. And they're like, is it chronic stress? Do I need to meditate? Do I need to dance? Do I need to, calm my nervous system? And I think they're just overwhelmed by the amount of information that is out there. So, as far as peptides, NAD, the GLP-1s, is there anything that you feel might be appropriate for these women that feel like they are stuck, even though they feel like they're doing all the things right?
Yes, usually I'm really big on blood work, so I like to see what's going on internally before I put patients on peptides. And peptides are another tool that I can use, right? Because we want to correct the foundations and make sure
Mhm.
like the diet, lifestyle, sleep, all of those things are in place because the peptides can be an added tool to get to a goal. So if someone has a really poor diet, they're not sleeping, like even with hormone replacement, peptides are the same. It's not going to work as well if we don't have the foundations corrected. So I will put people on like NAD while I'm working on correcting hormone imbalances or lowering inflammation. Same with the GLPs. I think that they're really great medications when they're used properly. And my goal with those is a lot of women get discouraged, especially, right, because they think that they're doing everything right. And a lot of them are really close to it, right? And sometimes we need to tweak macros or diet a little bit or work on exercise. Either they're doing too much or they need more weight training or something. But it can
Mhm.
be unmotivating when you think you're doing everything right and you're not losing any weight. And it's either there's some hormonal component to it or a stress component or something with the diet or lifestyle that needs to be changed. So I will use the GLPs as a jump start to get the
Okay.
the fat loss, and then it helps motivate women to start working out more and eating well when they start losing more weight. Because when you're not getting any results, people think, well, what's the point of eating healthy and working out?
Yeah.
I'm not seeing anything, right? So I put people on there with the intention of just keeping them on a couple months and then like, let's get you off. Some women will
Okay.
stand longer, which I do supervise them, but that's my plan with those women. It's to give them some motivation while we work on correcting hormones or inflammation or whatever else is going on.
Yeah, that makes sense. I know for the women that I teach, they do get a little discouraged because they do all the things right. And then in the first month, they see success. And then after that, they're like, wait, I've got to do this forever. This is really hard. And it's that mindset shift. Otherwise, they're kind of stuck on this journey. So I do like the idea of doing that as like a little, almost like a bonus, like, hey, you're doing the things, but let's accelerate it so you can continue to get that momentum and get those wins. So it makes you feel more motivated to continue.
Right. And I explain this to my patients too, because the last thing anyone would want was for you to invest your time and money in doing a shot and then you gain all the weight back after because we didn't correct what was originally the issue in the first place, right? So that's what I help my patients with.
Yes, absolutely. I have some clients where they did all the plastic surgery, for example, and then they got like their mommy makeover. And
Yeah.
then they didn't change the lifestyle. And then they're like, wait, I'm back to square one. And I'm like, okay, we need to change the lifestyle before we make a sudden change like that because it's going to go back. So
I
I love
have
that you said that.
I have seen those. I've seen the mommy makeovers and those are not for the faint of heart. Yes.
No, no, it's a very extensive procedures and recovery and all of the things. So I'm like, as a last resort, last, like hopefully you don't even need to get there. But
I know. I
yeah,
know. It's a lot to put your body through that and then have it come back
but,
to.
but people are looking for that quick fix, and I think a lot of people see that with like the GLP-1s. They're like, this is the next quick fix. So do you see anybody abusing these, if you will?
I don't allow my patients to do that. Most of my patients are on really low doses, honestly. I'm very supportive of the less medication, the better. Because again, the whole point is you still need to eat. Like we don't
Mhm.
want to create anorexia. And I've had a
Yes.
couple of patients come to me from other doctors that were doing that. And I think they were just giving these high doses because they were making more money. But
Mhm.
a lot of the times more medication does not mean more weight loss. Most of my patients have lost more weight at the lower dosings, honestly. And you still need to eat. You have to maintain muscle. You need to be able to lift weights. So we need to focus on eating. And that's where I think these medications get a bad rap because people are starving themselves,
Mhm.
working out. It's like you're going to lose muscle and you're going to look sick. And that's
Mhm.
not the kind of image that we're not creating anorexia. We want to create some health, right? And a little bit of fat loss while maintaining muscle.
Yeah. No, I absolutely love how you keep safety in mind because I have seen a lot of women here in San Diego where I don't want to say it's obvious, but they're very skinny, they have no muscle, and it makes me think like, are you doing this the right way? Are you like who's taking care of you?
They're not working out, I guarantee it, and most of them are probably not eating. And that's again with all that. I know I've had some patients ask me, like, am I going to lose all my hair? And I'm no, if you're eating and you're not
Yeah.
on these crazy high doses where your appetite is totally suppressed, you shouldn't have those problems.
So, what are some of the main side effects that you see or red flags, maybe, if because you said you're very safe about this, but maybe other doctors are over prescribing? What are some of like the red flags or symptoms that you commonly see? Is it just that they're not eating enough or?
Well, you can tell, like you said too, right? Because you can see someone that's lost all of their fat. Like they look sick and it ages you, right?
Mhm.
Like when they're on a crazy, like I've seen that where the skin starts to sag and it's like you cannot be on those crazy high doses long term. I put people
Mhm.
on short term and tell them to get off, but you can tell when someone's malnourished. I can, you know what I mean? And then
Yeah.
Then you have the biggest side effects I've seen with them, honestly, is nausea. I haven't had anyone have those crazy side effects. And I do think that happens when people are put on these crazy high doses right away, which that's not how the medication is supposed to work. It's low dosing until you need to bump up every
Hmm.
4 weeks or so and monitor it. But the biggest side effect I've seen is like mild nausea in my patients.
Okay.
That's a big one. And the women I've seen say they had some hair loss, were not eating enough. And then I'll cut the dose down because I'm like, again, I don't want them to be afraid to eat, especially
Yes.
if they're working out. That's what they have to be lifting weights. So
Yes. Yes. No, I absolutely love that approach. And for any of the listeners, if you are taking it and you're not working with Dr. Andrea, low dose first.
the lower the better. I'm telling you, low dose.
Yeah.
That's all you need. Yeah.
Yes. And then outside of the weight loss for women who are feeling depleted because maybe they're in that chronic stress state, what are some tools that they can start doing that you would recommend in order to start improving their energy and hormones? I know you talked about the vitamin D and the fish oil. Is there anything else that they can start to do this week?
Most women, I mean, they would need to be on some type of adrenal support. And again, like I'd have to see what the cortisol is like, but most
Mhm.
people, again, because I don't know anyone that doesn't have stress. The
Mhm.
biggest thing I also see that's most women under downplay is sleep.
Mhm.
You cannot live off 5 to 6 hours of sleep and think that you're not going to be tired all the time.
Yes. I just got off a call with somebody and she's like, "Oh, I'm only 28. It's fine. Like I only get 4 hours of sleep, but I'm just, I'm motivated. I'm doing the thing." And I'm like, "Girl, you're going to burn yourself out. You need to strive for like 8 hours, not 4."
8, I know, and you can't catch up on sleep. And then the other big thing I see also is I think we feel like we have to overdo it, especially with cardio and workouts, but you should be having rest days. Like you shouldn't be working out 7 days a week. Your body needs to rest. With those high
Yeah.
achieving women, I know too, it's like feeling like you have to do something all the time, but sometimes the best thing you can do is take a break.
Yes, and it's so tough. I actually met a new friend, and we got coffee this morning. And I told her I felt guilty for meeting a new friend to get coffee because I wasn't being quote unquote productive. Because my daughter, I just dropped her off at daycare, and then usually I work all day, but I decided I'm going to make time. I'm working from home today. I'm going to go, have an hour break for coffee. And the guilt that I felt, like literally, I felt it in my heart, like I'm not being productive enough. I'm being lazy. And so it's like so tough sometimes to separate ourselves from like high achieving, go, do, to just being present, being relaxed.
I know. I don't know why women still feel like they have to like do everything and not take care of themselves. Because I see it a lot with my patients.
Hmm.
Like you can't take care of everyone if you're struggling yourself, it's hard.
Yes, yes. And I think for myself, I like have to detox from social media because I check myself
Oh
scrolling.
gosh.
And I'm like, even if I know that working out and movement is good for me, but it's that guilt of like, because my kids are in school, that I'm not spending the time with them and I should do it when they're sleeping instead of you know what I mean? It's like this weird thing that all of us moms and women are going through where it's like we feel guilty if we do, we feel guilty if we don't. We're trying to do all the things. So I'm like, I need to get off social media and stop seeing what's working for other people because it's not my life.
Right. It's about you. Right. Exactly. And don't feel guilty. You need some downtime. It's okay.
Yes, yes. And it's as all the high achieving moms again and again, I'm sure you see this all the time too, is like we're like, give me a plan and then I can figure out how to relax.
I, I know. And I'm like, take 30 minutes and you're going to shut off everything and not respond to your emails and not answer your phone. That's all they-
Yes, yes. So take off your watch so you're not buzzed by somebody texting you.
yes. It's hard. The older I'm getting, I am still learning how to place boundaries. I think that's a big problem with a lot of women having, you can have boundaries with family and everything too. It's okay.
Yes, yes, it's that guilt. So, if you could give one piece of advice to the high achieving mama, we feel overwhelmed, we feel exhausted. Do you think it is just get some rest? Or is there anything else that you're like, do this, babe? You got to
I
do
think
this.
it's so much more than just I think it's about a mindset too, like prioritize yourself.
Hmm.
Have to and not feel guilty again because you can't take care of everyone else if you're feeling depleted. We're not the Energizer Bunny. Eventually, we run out of juice, right? You need a little recharge. That's anything. You can't drive your car in forever. Eventually, you have to put gas in it. Think about your body like that. Like what we put in, the amount of sleep, everything like that. It's a recharge. So, um, I think it's okay to not feel guilty to just have alone time or do something that you enjoy. And maybe it's by yourself, maybe it's with your friends. This is what I talk to women all day about because again, I don't know why we feel like we have to conquer the world all the time and burn
Yeah.
out. It's not worth it.
Yes. And I love the analogy you used about a car because our vehicle is our body and we only get one. After 5, 7 years, we're not trading trading it in for a new one. We got to keep it up and do all of those checks regularly.
The engine check. Yes, think of it like that. You need a little reset and it's okay
Yes, yes,
for your mental health, right? It's a big thing.
yes. Okay, so where can our listeners connect with you and learn more about your work? I've loved everything you've said so far, and it's so nice to have that perspective when somebody truly cares about the whole self and not just like a lot of doctors out there are like, I'm going to prescribe this and I'll get more money. So it's so nice to have your perspective. Where can women work with you?
Yeah, so I'm based out of Newport Beach, California, Orange County. My practice is Reclaim Integrative, and you can find me online at Dr. Andrea NMD on Instagram or reclaimintegrative.com.
Amazing, amazing. So I will link all of those into the show notes.
Perfect.
And I'll probably reach out to you just because once I'm done breastfeeding, I might need some extra support with we'll see how my energy levels. Right now, my energy is just in waves. I haven't weaned her, so I'm waking up. I'm tired. My testosterone levels are low. The last time I got my blood work done, my testosterone levels were low. Everything was low, but they're like, no supplements because you're breastfeeding.
Yeah, it's hard when you're breastfeeding. I know. And you're dealing with all those hormonal fluctuations on top of it. It's a lot. That's a lot. Yeah.
Yeah.
Your skin is nice and glowy though.
Thanks. I know. So it's funny. I don't know if you're gonna hate me for this, but I use beef tallow.
Okay. One of the in my office, there's a girl that she makes it. So there's some
Oh,
it seems to be like popular. Yeah.
yeah. A lot of people are like, "Oh my gosh, you're rubbing beef tallow on your face." I'm like, it's giving me that shine. I like
It
it.
works. Who cares? Like everyone's gonna have something negative to say about everything. You know what I mean? Like if it works for you, who cares? Like
Yes,
use
I
it.
agree. Well, thank you so much for your time today. I really appreciated all of your insight and information for our listeners, and we will chat soon.
Okay, thank you so much. Have a good rest of your day.
You too.
Okay, bye-bye.
Bye.